Steve Simpfendorfer here, cereal plant pathologist with New South Wales DPI based at Tamworth. Just want to have a quick talk about leaf diseases in cereals. So first we'll cover barley. So the risk going into this year is certainly that there could be an increase in leaf disease. We're having a good season. You can see behind me it's 11 o'clock in the morning here at Tamworth and we've still got fog hanging around. So these leaf diseases basically require high humidity to infect. So it's these low rainfall events, high humidity can actually keep them cycling. So these are some diagnostic samples that come in. A volunteer barley crop here. You can see the risk with that. We've had that rainfall conducive conditions. This is loaded up with net form and net blotch. So very high levels. So that's now created a risk going forward. And even younger plants here, so have got a seedling infection at that tilling stage, again of net form in this case. So these samples have come from the central western New South Wales. So these things are kicking over. But even here at Tamworth, this is just an area where we throw our stubble after our samples. You can see a barley plant here that's come up, a volunteer, that's actually full of scald. So the key point I'm trying to make here is that we've got conducive conditions this year for some of these pathogens to cycle. Coming off a run of dry years, we actually find that the pathogens are surviving longer in the stubble residue. So the biggest risk for barley disease is planting barley on barley stubble. But unfortunately with that low decomposition rate, with a run of droughts, that stubble can actually be a couple of years old. So it can even be 217, 218 stubble can be your main inoculum source. So the key thing with this too is also make sure you get it identified. There's a lot of physiological spotting that happens in barley, not related to disease. So get it identified by pathologists. You can send me photos on the mobile and we can actually do it. It's really just looking at distribution within individual tillers is a real giveaway whether it's physiological or it's actually disease related. So with leaf diseases, the lesions are always random across an individual leaf. They don't concentrate towards the tip. Whereas we find, here's a leaf here, probably hard to see. You can see that the lesions are evenly spread across it. It's just randomly where a spore lands and infects. Whereas with a lot of our physiological spotting, they concentrate towards the leaf tip. So yeah, hopefully we have a great season, and if you need help, just contact us. We're here to help. Thank you.